Assalamu alaikum respected doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 18th video of rapid revision course of operative dentistry, which is very important for NLE exam, MDS, NBD as well as for BDS final year students. In this video we will cover whole chapter of tooth discoloration, which is come in operative dentistry and endodontics. And in this chapter, we will discuss causes of tooth discoloration and management of tooth discoloration, in which we will study in detail about bleaching, microabrasion, macroabrasion, and veneers. Now, first we start from causes of tooth discoloration. The causes of tooth discoloration is a stains, which is of three types. Number one, extrinsic stain, which have good prognosis, mean it is easy to white these teeth with extrinsic stain. Second is the intrinsic stain, which have fair prognosis, mean less prognosis. Third is the age-related stains. First, extrinsic stain. Extrinsic stain is due to chromogenic bacteria adsorb into plaque. When chromogenic bacteria adsorb into plaque, mean aid on the plaque surface. It is a chromogenic bacteria. Chromo mean color, genic mean to produce. It produce color. Now the extrinsic staining is due to chromogenic bacteria. Next, we divide extrinsic stain into A and B, mean two category. Number one, A is the non-metallic stain and B is the metallic stain. Mean extrinsic stain divide into two, non-metallic stain and metallic stain. In non-metallic stains, there is a copy which cause to extrinsic staining. Next is a T, next is smoking, and next in chlorohexidine stain, which are present in the mouthwash. If we use mouthwash more than 2 weeks, it causes external extrinsic staining. Second is the metallic stains. Metallic stain is number one from metallic stains are of two types. Number one is the occupational exposure. Second is the dietary supplement. In occupational exposure, for example, iron, which cause black stain, copper, which cause green stain, like in industries. Second is the dietary supplement. For example, iron supplement should be taken for few weeks, then stop for few weeks before they can be taken again. This is all about extrinsic stain. Now come to the intrinsic stain, which have fair prognosis, mean less prognosis. Occur during tooth formation of after eruption. For example, fluorosis come in intrinsic stain, tetracycline staining come in intrinsic stain, dentino or amylogenesis imperfecta come in intrinsic stain, enamel hypoplasia come in intrinsic stain, trauma which cause discoloration, it is also intrinsic stain. Next is the obturation material remnant. When we leave gata parka in the pulp chamber, it causes tooth discoloration, which is intrinsic stain. Second is the pulpal remnant. Next is the iodine containing intracanal medicaments like Metapex. These are responsible for intrinsic staining. Now, intrinsic staining have fair prognosis, mean very less prognosis and difficult to whiten these teeth. And in previous NLE exam, this MCQs was come. Bleaching have less effect on tetracycline staining because it is intrinsic stain. Third is the age-related stains. It is due to thinning of enamel plus secondary dentin deposition plus prolonged exposure to staining agent. In age-related staining, the tooth become yellow because they due to thinning of enamel and deposition of secondary dentine, the yellowish dentine is exposed, therefore the tooth will be yellow in color due to age-related stain. Now, the causes of tooth discoloration is the stain, which is of 3 types. Now come to the management. In management of tooth discoloration, first we study about bleaching and then about micro and macro. Now, in management of tooth discoloration, first is the bleaching. Now, this is very important for an early exam because most of MCQs come from bleaching. Now, first, what is bleaching? How we define bleaching? The whitening of tooth surface is called bleaching. Now, types of bleaching agent, there are 10 types of bleaching agent which are used. Number 1 is the hydrogen peroxide, which are most commonly used in 35%. Second is the carbamide peroxide, and next is the sodium percarbonate. Fourth is the chloride lime. Fifth is the chlorine, calcium hydroxide plus acetic acid, and sixth is the aluminum chloride. Seventh is the oxalic acid. Eighth is the pyrozine. Ninth is the cyanide of potassium, and 10th is the sodium hypophosphate. Now come to the indications of bleaching. What are the indications of bleaching? There are 2 indications of bleaching. Number 1 is the discoloration. If tooth is discolor, we will go for bleaching. Second is the dissatisfaction of the tooth color. If patient is not satisfied with its tooth color, then we go for bleaching. These are the 2 indications of bleaching. Now come to the contraindications of bleaching. In bleaching, there are 9 contraindications of bleaching. Number 1 is the hypersensitivity. If teeth are hypersensitive due to bleaching agent, it will be more sensitive than bleaching is contraindication. Next is a large pulp. If tooth have large pulp, again there will be sensitivity of pulp from bleaching agents. Again, bleaching is contraindication. Third is the teeth with cracks. If teeth are cracks, again bleaching agent traumatize the pulp. Fourth is the pregnant and lactating women. In pregnant and lactating women, like other treatment modalities is contraindicated, same bleaching is contraindicated because in bleaching there is a free radical formation. Fifth is the gingival recession. In gingival recession, bleaching agent cause sensitivity as well as cervical area root resorption. Sixth is the poor oral hygiene. A patient have poor oral hygiene, again if we do bleaching, patient again take coffee, tea, and do not take care of oral cavity, again there will be relapse of these stain. There is no advantage for bleaching. Seventh is the severe enamel loss. If there is severe enamel loss, we will go for veneers because again bleaching agent will cause sensitivity of dentine. Next is the bruxism patient. Again there will be exposure to bleaching agent. Ninth is the exposed root surface. If exposed root surface, there will be root resorption by bleaching agent. These are the contraindications of bleaching. Now come to the types of bleaching agent. Now we make types of bleaching agent on the basis of types of bleaching, and we make types of bleaching on the basis of tooth vitality. Either tooth is not vital or non-vital. First, we divide the bleaching types on the basis of tooth vitality. Either tooth is vital or non-vital. If tooth is non-vital, for vital tooth, again there is 2 types of bleaching. One is office, second is the home. Office we do in dental clinic or in dental ward for vital tooth, and in home we make a tray to patient. They put the bleaching agent in the tray and wear the tray in the night for 4 to 6 hours, and in morning they wash the tray. This is the home bleaching technique. Second, for non-vital tooth mean RCT treated tooth, again we will go for one is office bleaching, second is home bleaching. Office bleaching we do in dental ward or dental clinic, and home bleaching again we in home bleaching we place the material and inside the pulp chamber, and patient come and go to our clinic, and when patient come to home and go to home and come to clinic again, this is known as walking bleaching. And in non-vital tooth, when we do in office, this is known as thermocatalytic bleaching because we apply heat. Now again we divide the bleaching into mean types of bleaching into two types. Number one is a vital bleaching, second is a non-vital bleaching. Vital bleaching, again why we divide bleaching into vital? Because we do on vital tooth, and non-vital bleaching we do on non-vital tooth. Then in vital there are two types. One we do in dental clinic or ward, this is known as office bleaching. Second is the home bleaching when we make tray per patient. Second is the per non-vital tooth, again in office mean office and home. Office is also known as thermocatalytic bleaching because we apply heat, and home also known as walking bleaching because patient go and come to a dental ward or dental clinic. Now come to the detail. First we discuss about vital bleaching, which we do in office, mean office bleaching. This is we do in clinic or ward. Now for an early exam you should remember which bleaching agent used in per vital bleaching in office and home, and per non-vital in office and home. First is the in office bleaching. In office bleaching, first we applied a liquidum is placed along gingival margin, mean we place liquidum along the gingival margin and light cure. Then bleaching agent is placed and activated by laser or light to increase its temperature and effectiveness. This is the 35% hydrogen peroxide we use for office bleaching, and the mode of action of bleaching agent is the mode of action of every bleaching agent is it dissociate into free radical bleaching agent, and these free radical change the high carbon organic pigments into high molecular weight organic pigment into low molecular weight, because high molecular weight reflect more light, therefore the tooth are discolor. When they change into light chain in light weight molecule, they reflect less light, the tooth will be looking white. Now the mode of action of hydrogen peroxide is hydrogen peroxide diffuse through organic matrix of enamel and dentine, then form free radicals which attack with organic molecules. Because the mode of action of bleaching agent is oxidation. They oxidize the heavy weight molecule, form free radical which attack with organic molecule, which release other free radical which react unsaturated bond, so changes in the organic molecule occur, and heavy chain compound convert the chain into lighter color which reflect less light, the tooth will be looking white. Now in office bleaching, per NLE exam, the agent per vital bleaching in office, the agent is hydrogen peroxide, which is 35%. Now, next is the bleaching kit have capsule of vitamin E used when there is a bleaching of tissue due to seepage of bleaching gel under the barrier. Vitamin E is a powerful antioxidant. It reverses the soft tissue damage in the gingiva. There is no actual difference in efficiency when you bleach with or without light. Light is only used because the patient expects it. Whitening should result in at least 2 shades color change. Whitening should result in at least 2 shades of color change. But for your annual exam is very important is the agent and its percentage. Now come to the vital bleaching. Now come to the home bleaching. Home bleaching give the best result. For home bleaching, the agent you should remember is the 10% carbamide peroxide, and this is used in a custom tray. Adding carbapol will extend its action for 8 hours, can be used overnight because it is used in night. Whitening strip containing hydrogen peroxide action is only for 30 minutes. In the initial stage of bleaching, teeth may white spot or too white in general. This become less with time. Initially it become too white. Now the important thing is for vital home bleaching technique we use 10% carbamide peroxide. This is the carbamide peroxide. At home bleach, mostly carbamide peroxide break down into urea and hydrogen peroxide, which when introduced in mouth. Hydrogen peroxide change the high carbon ring into lighter ring, which reflect less light. The tooth will looking white. This is the mode of action of carbamide peroxide. 10% carbamide peroxide dissociate into hydrogen peroxide and urea, and this hydrogen peroxide cause whitening of teeth. Now come to the in vital bleaching. Now come to the office and home bleaching whole technique. How we apply vital bleaching in office and in home. First, in office we apply rubber dam, then place protective barrier in the gums, then we place 35% hydrogen peroxide in tooth surface, applying light or heat for the activation. It takes 1 to 5 appointments of 45 minutes each. We should recall the patient from 1 to 5 appointments, and in each appointment there are 45 minutes. Each appointment take 45 minutes. These 45 minutes is important, and 35% hydrogen peroxide is important, and then solution is then rinse off. This is the technique of office vital bleaching. Now come to the home vital bleaching in vital tooth. First we take impression of patient and send to the lab, and we make a tray for patient. First is the fabrication of tray. Look at the diagram. In yellow, in bluish dish there is a white tray. Then instructed to place bleaching agent 10% carbamide peroxide into tray and wear at night. Should be worn 4 to 6 hours daily. Recall the patient after 5 to 7 days to check the progress. 10% carbamide peroxide or 3.4% carbamide peroxide is used. Now the important thing is for home bleaching 10% carbamide peroxide is used. Now come to the non-vital bleaching. Non-vital bleaching is done in non-vital tooth, RCT treated teeth. The agent which is used in non-vital teeth bleaching is again in office hydrogen peroxide or combination of hydrogen peroxide plus distilled water, which is known as superexol. And for office bleaching, which is known as working bleaching, we use sodium perborate, which decompose into sodium metaborate and hydrogen peroxide and nascent oxygen. These chemicals are mixed together to a thick paste and sealed in the excess cavity. Next is the agent is the thiourea. Now come to the detail. First is the non-vital bleaching. First is the office bleaching, which is known as thermocatalytic bleaching because we apply heat. And here for office bleaching, the agent is the 35% hydrogen peroxide or combination of hydrogen peroxide plus distilled water, which is known as superhexol. In thermocatalytic bleaching, it involves placing the oxidizing agent in the pulp chamber and applying heat, thereby known as thermocatalytic. Heat is applied by heat lamps, flammable instrument, etc. 30 to 35% hydrogen peroxide is placed in a chamber on a cotton pellet, followed by UV light exposure for 2 minutes. This is a thermocatalytic bleaching. For thermocatalytic bleaching, the agent which is used is the hydrogen peroxide or superhexol, which is a combination of hydrogen peroxide plus distilled water. Placed in the canal and plus heat application, therefore known as thermocatalytic bleaching. A side effect of thermocatalytic bleaching is the external cervical root resorption. Now come to the in non-vital bleaching. Next is the walking bleaching technique, which is also known as home technique, and here the chemical which is used is the sodium perborate. Now remember here for these chemical agents are very important. For vital bleaching, in office we use 35% hydrogen peroxide, in home we use carbamide peroxide 10%. In non-vital, in office we use the 35% hydrogen peroxide or combination of hydrogen peroxide plus distilled water, which is superhexol. In home, which is also known as walking bleaching, we use carbamide peroxide. These chemicals are very, very important. These names and percentage are very, very important. Now come to the walking bleaching technique. In walking bleaching technique, we remove GP to a level below the cemento enamel junction, then apply barrier over Gathaparka, intermediate restoration or GIC or resin modified GIC, then place the bleaching agent and seal the tooth with GIC and recall the patient after 1 week, open the chamber and then remove GP and then open the chamber and change the bleaching agent and again apply the barrier over GP and place cotton inside the cavity. Patient goes home. At home the cotton pellet is removed. The patient inject the bleaching agent inside the cavity and inside the tray. Simple walking bleaching technique. In the walking bleaching technique, we remove Gatha Parcha at the level of cemento enamel junction, then apply barrier and then place the agent and patient recall after 1 week and again change the chemical time by time. Now in first time we change and second time the patient come to the home and again is change in the these sodium perborate in the home. This is the now these are the steps of walking bleaching. Tooth is isolated with rubber dam. Around 2 mm of GP is removed. This is important, 2 mm. Then paste is prepared by mixing sodium perborate and 30% hydrogen peroxide. And paste is inserted into the chamber. Excessive paste is removed. Cavity is placed. Rubber dam is removed. Procedure is repeated. And patient is walking to home and come to the clinic. This is all about bleaching. Now, what are the other methods for tooth whitening? Mean other than bleaching, mean alternative to bleaching. These are the microabrasion and macroabrasion. Next is the bonded resin, composite veneer. These are the composite veneer which are bonded to the tooth surface by resin. Next is the porcelain veneer. And veneer are the layer of thin material, aesthetic material, which are applied mainly on the facial surface for aesthetic. Now we will discuss about microabrasion and macroabrasion. What is microabrasion? Tooth surface is subjected to acid and abrasive. First, we apply acid, they dissolve the discolor area, and then apply abrasive, they remove the discolor area. This is a microabrasion. Tooth surface is subjected to acid and abrasive. Acid remove mineral content, leaving weakened surface, which is removed by abrasive. First we apply acid, they remove the calcium and phosphate, the area will be weak. Then apply abrasive, which remove the weakened area. Abrasive suspended in water soluble gel containing low concentration of HCl is applied. Mean abrasive it is in the form of HCl. Now come to the macroabrasion. In macroabrasion, it is achieved by applying fine diamond or carbide finishing burr to enamel at relatively low speed and with a very light pressure to remove these stains. These are the macroabrasion, and next is the veneer, which is the resin bonded veneer and porcelain veneer. This is all about tooth discoloration, the causes of tooth discoloration, stains, and the management, which is bleaching, microabrasion and veneer. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.